The Charlotte Ledger Podcast is a member of the Queen City Podcast Network.
Hey, it's Tony Mecia with the Charlotte Ledger, and you're listening to the Charlotte Ledger Podcast. You can find out more about the Charlotte Ledger at thecharlotteledger.com. Today's podcast episode is about trends in the healthcare industry. It's a recording of my conversation with Michelle Crouch at the Sharon Retirement Community on January 6th, 2025. Michelle is a longtime reporter, and she talks about some of what she's seen reporting on and writing about healthcare in Charlotte. Her articles appear regularly in the Charlotte Ledger through our partnership with North Carolina Health News, which is a nonprofit news organization that covers health issues in North Carolina. Without further ado, here's our conversation. Well, good afternoon. My name is Tony Mecia with the Charlotte Ledger, and I appreciate everybody coming out this afternoon. We're going to have a little bit of a discussion on healthcare. I know that's a very important topic. We're going to talk a little bit about it. We're going to take your questions. We definitely want to hear from you. This is, as Jessica mentioned, an ongoing series that we have through a partnership between the Charlotte Ledger and the Sharon, in which we come in and talk and have discussions on current topics, a different one each month. With me today is Michelle Crouch. Michelle is a reporter. She writes articles on the topic of healthcare for the Charlotte Ledger, and it's a partnership that the Charlotte Ledger has with North Carolina Health News. That's a nonprofit statewide newsroom that covers a variety of healthcare topics in North Carolina, and they do a great job. We're happy to partner with them, and we teamed up a few years ago, and we're able to get Michelle writing a lot of articles for us on a lot of important healthcare topics, a really wide range of things, and we'll get into some of those. But a little background on Michelle. For nearly a decade, she was a reporter and an editor at the Charlotte Observer, where she covered a variety of topics, a variety of beats, including higher education, local government, growth and development. So she's been in this community for a while, knows it pretty well. And after she left the Observer, she started writing as a freelancer, covering a lot of different topics, a lot of times with a healthcare bent to them. She's written for publications including Reader's Digest and AARP. And we're going to talk today just about a number of issues as it relates to healthcare. And it's a changing industry. It's a large industry. It's an industry that's very difficult sometimes to understand. You have a lot of different entities, healthcare companies, insurers, doctors, large hospital systems, and she's tries her best to go out and understand it and write articles that sort of explain it and let people know what's going on. She's written a bunch of articles for us on the topic of medical debt, on billing issues, mental health, and then she had an article today on artificial intelligence. I should also mention that as we're having this discussion, we're recording this discussion, and we will put it out as a podcast, as the Charlotte Ledger Podcast, so that if people weren't here, they can they can listen to it, or if you want to go back and listen to it, you can. So with that, Michelle, welcome.
Thanks so much for having me.
Just wanted to start off by asking you, how did you get interested in healthcare as a topic?
Well, when I started freelancing, I was writing about a lot of different topics, but I quickly noticed that the stories I wrote that seemed to have the most impact were the stories when I wrote about people's health. Nothing really impacts us more than our health. And I wanted to give people information they need to make better decisions when it comes to everything from choosing doctors to saving money on healthcare, and also to help people and our readers understand why our healthcare system is the way that it is and potential solutions to some of the problems with it.
Okay, so you mentioned you wanted to help people understand why our healthcare system is the way it is. Why is our healthcare system the way it is?
I was really hoping you were not going to ask that follow-up question, because nobody can really explain why our healthcare system is the way it is. As you guys all know, and as we all know, it is so complicated and we have so many different players that it is really hard for any one person to get a handle on all of it. And so my strategy in my reporting is to kind of bite off little pieces and try to explain why that particular part is the way it is and potential solutions, because it is such a big and complex system with so many different players.
And, obviously there are a lot of trends in healthcare. There are a lot of things that are changing. And I think, a lot of us think of the healthcare industry when we were younger and look at it and how it is today and how much it's changed. How would you describe the landscape of healthcare in Charlotte?
Well, in Charlotte and across the country, healthcare is changing significantly in a lot of different ways. But probably the biggest way that a lot of us are seeing and that a lot of patients are seeing is consolidation. So healthcare systems are getting bigger and bigger. You guys have seen this. It's not just your local hospital anymore. Now it's your hospital is merging with other hospitals. It's buying specialty clinics. It's buying physician offices. And so we have these mega hospitals. As you guys know, Atrium Health, our largest healthcare system here in Charlotte, they merged with Advocate Aurora in 2022, and that's now the third largest public hospital system in the country. Novant is also snapping up hospitals in South Carolina. They just put in a request to build a $287 million hospital in the Triangle area. They're trying to move into Western North Carolina. And so hospitals are getting bigger. And what does that mean for patients? Research shows that as hospitals grow, prices go up. And it's unclear what happens to the quality of care. Studies are mixed on that. Hospitals will tell you that they take the money that they save from growing and they invest it in equipment and technology that make their health care better. But it's unclear if that's the case. But we do know for sure, all of the research studies have shown that patients generally pay more as healthcare consolidates and hospitals get bigger.
So can you help us understand why is there such a drive to consolidate healthcare? Why is it that we have two main players in Charlotte and we don't have dozens? I mean, what's the driving force behind that?
Well, the larger a hospital system is, the more economies of scale they have. They can cut costs, and let me rephrase that. As they get bigger, they have more buying power, more purchasing power, and so they are stronger negotiators with everyone that supplies the drugs to them, that supplies equipment to them, but more importantly, they have more bargaining power with insurance companies. So insurance companies, they have to set the rates that healthcare systems and physicians get paid for the care that you receive. And so the bigger they are, the more bargaining power they have, and the higher those rates can be so that they can get more money for each service that they provide.
And I know you've written a fair amount. A lot of people might be surprised to learn that unlike a lot of corporations, which are for-profit corporations, that a lot of hospitals are not for-profit corporations. They're nonprofit corporations, or in Atrium's case, they're affiliated with a unit of local government. Can you explain that, sort of how that works, why that is?
Most hospitals started as nonprofits because they were providing a lot of care to the poor in their communities. And they needed to be nonprofits in order to afford that care and raise the money to provide that free care. And that's still the case. The majority of the large hospital systems in our country are nonprofits. Novant Health is a nonprofit. Atrium Health is a government entity. It started as a government hospital here in Charlotte. And because they are nonprofits and government entities instead of for-profit entities, they have incredible tax benefits. And so they're not having to pay the same taxes that for-profit corporations have to pay. And so that has been an issue of contention. There are critics that say that that is creating a burden on the community because they're buying up more and more property. Every time they buy a for-profit physician's practice, that property comes off the tax rolls. And so it's millions of dollars that is coming off the tax rolls each as they grow bigger and bigger. The hospitals do provide free care. They provide discounted care. They provide community clinics. And so, they would argue that they are providing a lot of benefit, a lot of community benefit in exchange for those tax exemptions that they receive.
And I think if you look at a lot of polling on how people perceive our healthcare system, obviously I think a lot of people trust their doctors and they really like their doctors. But I think the polling also shows that they don't necessarily have the same feelings toward the delivery of healthcare and some of the issues that are outside of the examination room, say. And one of those, and I know you've written about this a bunch, is billing and challenges with billing. Could you talk about maybe some of the stories you've written about medical billing and how that works and sometimes how that doesn't work?
Do you guys feel that medical billing is working? So whenever I tell somebody what I do for a living, they almost always have a story about a billing frustration. The estimates are that about half of all medical bills have an error, half. And the people I talk to, almost everybody that I talk to has a story about some frustration with medical billing. And part of the reason it's so complicated is because of the way it works in this country, that everybody has a different insurance provider. Even if you're on Medicare, there's different Medicare Advantage plans. There's traditional Medicare, there's Plan D, there's Plan B. So it's complicated. And the insurer is supposed to pay the bill, but then you might get billed the difference. And so that adds another layer of complexity. And we also have something like 80,000 different medical billing codes. So it's easy for an error to happen there. So there's just so much complexity in it that it creates a lot of frustration for people. So yes, people love their doctors, but people get very, very frustrated by our medical billing system.
Is there any hope for making it better?
That's $1 million question. There's a lot that's happening to try to improve it. At the federal level, there are price transparency laws. And the idea behind this is that doctors and hospitals should post the price of different services and different types of care so that you can shop around. And so there's been some progress made with that. All hospitals, if you go to their site, you should be able to type in your insurance and what procedure you're getting, and the price should come back. So you should be able to know how much something would cost. But unfortunately, in reality, it's not that simple. A lot of times you don't know which of the many different codes is your procedure that you're getting, or you get to the doctor, you get to the hospital for your surgery, and they end up having to do something more than what they anticipated. And so the price is different than what you expected. And then there's one of the really hot button issues right now are called facility fees. And I read a story on this a couple months ago. These are fees that hospitals can charge for care because on top of just the cost of the care itself, the care that your physician provides. And so traditionally, these fees were added when you went to the hospital to get care. It would be added to help cover the cost of all of the different services that the hospital provides, like being open 24 hours, seeing anybody who walks in the door, that kind of thing. But what has happened in recent years that has really frustrated patients is that as hospitals have purchased physicians' offices, you might go see your doctor for a regular visit and suddenly there is a facility fee added to the bill because a hospital system has purchased the doctor's office. So I interviewed an oncology patient who had cancer. She had been seeing the same oncologist for years for her follow-up care. Novant Health purchased that oncology clinic. She went for her regular scheduled visit, and her bill was hundreds of dollars more because Novant owned the facility and they were able to start charging a facility fee for every visit.
Do you have any tips for consumers about how they can navigate these kinds of situations?
Probably my best advice is don't give up. Get on the phone, make the phone call, take good notes. Who did you talk to? How long were you on hold? What did they tell you? Ask for a supervisor. ask for the supervisor, and if you still are frustrated, then you might need to take it further, whether that's posting about it on social media or sending a complaint to the hospital ombudsman. But the patients I've talked to, if you are persistent, a lot of times you can eventually get someone to listen to you. You can also ask for, well, if you go to the Charlotte Ledger's website, we did do a list of, 10 tips for disputing a medical bill, where depending on what the issue is, there's a lot of different strategies that you can take.
Okay, switching gears a little bit. A few months ago, you and I went with Atrium and we took a tour of the Pearl, which is the new medical center, medical innovation campus in the Dilworth, Midtown area. What is, and it's going to have a medical school, there will be research institutes. The hope is that they can, attract a lot more medical device, medical research type of companies. What is that medical school going to mean for Charlotte? Because for many years, as you know, Charlotte has not had a 4-year medical school, and supposedly the largest city in the country without a 4-year medical school. What's that going to mean for Charlotte?
It is going to be transformative for Charlotte. It's not just that we're going to have a medical school. It's so much more than that. This medical campus, or innovation district, as they're calling it, is going to have, it's going to attract young medical talent, young device companies that are investing in medical technologies, in AI, in medical equipment. The idea is to create a place where they can come and have access to. We've already attracted some companies that are very innovative and that have a lot of expertise in these areas, and that's just going to attract more companies to choose Charlotte.
And then sort of continuing on the theme of technology, you had a story today about the use of artificial intelligence. And I know this is a topic that a lot of companies and a lot of different industries are experimenting with, are trying to glean insights on. What did you find about the use of artificial intelligence in medicine?
Well, AI is being used in a lot of different ways in healthcare. My story today is probably the way that you as a patient are most likely to see it first. And that's that doctors are recording their visits with patients, and then AI is taking that recording and summarizing it into a summary of your visit that goes into your medical record. Atrium Health has 1,500 doctors using the system. Novant also is using the system along with some other healthcare systems across the state. And it's great for physicians. It saves them the time of having to spend hours recording what happened in their visits with patients. It allows them to look patients in the eye instead of at the computer screen during a physician's visit. So those are some great things about it. There are concerns about privacy, and there's concerns about accuracy. The way the system is set up is that the physicians get the summary of the visit, and then they review the summary, and they can make necessary corrections before it becomes part of your medical record. And so that's the key part, is to make sure that they're doing those reviews and making sure it's accurate, because research has shown that these systems, they make mistakes. They fabricate information. They add, it's called hallucinations. There's even a word for it. They'll sometimes add things in that were never said in the appointment. And so that is really the key question with that technology in particular is there a mechanism to make sure that these overworked physicians are getting the time to review these summaries and making sure they're accurate? AI is also being used in some other cool ways. It's scanning patient X-rays, patient CAT scans, MRIs to try to flag the most acute cases and let physicians know almost immediately if somebody is experiencing a stroke or some other life-threatening emergency. It's helping physicians decide which cancerous nodules need a biopsy or not. It's some Atrium, for example, they're using AI to draft responses to patient messages that you might send your doctor in the portal. So if you email your doctor, AI will create a response. Your doctor, again, will review it, or maybe your doctor's assistant will be reviewing it to make sure that it's accurate before it gets sent back to you. So AI is being used in a lot of interesting ways already, and I expect it to become more a part of healthcare as the year goes on.
Okay, I know we build this talk as sort of looking at trends in healthcare, and I like to think of it as maybe looking into the future. Do you have any predictions for where healthcare is going? We've touched on a lot of different trends, different technologies and different processes and how they're changing the delivery of healthcare. Do you have any crystal ball prognostications of where things are going?
Well, I think given the current frustration with our healthcare system, including frustrations with the way that insurance companies are requiring prior authorization more and more, they're denying care more and more, frustration with the rising cost of healthcare. We have some of the most expensive healthcare in the world, and yet our outcomes are nowhere near as good as those in other countries. And so I suspect that in the next few years, there is going to be pressure for almost a complete overhaul of our current system. I don't have a crystal ball, and experts have been saying that for years, decades really. But I do think we're getting to the point where Americans are so frustrated with the current system that something's got to give.
And I appreciate your expertise in going out on a limb and looking to the future. It's always hard to predict the future. But I wanted to talk a little bit, just sort of final minutes here, and then we definitely want to take the questions of the audience. But what is, as you know, you've been a reporter for a long time. You're wading into a field that is very difficult to understand sometimes. What is your process like of when you identify a story, or how do you identify a story and then go about reporting that story in an area that is so at times difficult to understand?
So most of my stories come from patients, come from regular people. A lot of my stories come from a conversation I have with a friend. Stories come from emails that I get from somebody that read something that I wrote. And so if something seems interesting to me, I kind of assume this is probably going to be interesting to other people as well. So story about facilities fees came from a patient who was frustrated that he had been going to see the same provider for years and he suddenly had a much higher bill. And so that's where my stories come from. And then I take the time to try to understand why the patient is experiencing that problem and get to the bottom of it. And a lot of times it turns out that whatever issue that reader was experiencing, a lot of others are experiencing too.
Yeah, and I think one of the great things about covering a beat, and I can just say this myself as a reporter and editor, is that, you know, you're not inherently an expert in the topics that you're covering, but what you do have is you have a sort of a sense of curiosity, and you know the questions to ask, where you can get up to speed and be, you know, competent in writing about a topic if you're talking to the right people, interviewing the right people. And I think that approach of, making it patient-centric, of talking to actual people and what their concerns are, and then using that as the basis of a story, I think is a really good and a really good approach to take. And so I think that's actually a good segue into, we'd like to hear from you all. Any questions that you have about the healthcare industry for Michelle? Again, full disclosure, she is not a doctor. She is not a nurse practitioner. She could not solve your back pain or the problem with your toe. But she does, I think, have a pretty good sense in general of sort of where the industry is and where it's going. And happy to take your questions. I know you said you got some cards you left in the back, so if people want to pass along any ideas or tips, you can do that too. But I'm going to come around with a microphone.
I wanted to know if you were surprised by the outcry, the response, when the United Healthcare president or chairman, CEO, and when he was murdered, how so many people went online praising the young man who murdered him. To me, that shows there's a lot of frustration out there, I assume, with the insurance industry. We had an experience a year ago with the hospital bill, and it was not fun. Thank you.
Yes. What happened to him was tragic, but yet I would say that the response was surprising, because even though, I'm sorry, I'm a writer. I'm not used to being in front of a crowd. So, but I was kind of shocked that people would take it that far on one hand, but on the other hand, I have seen firsthand how frustrating it is when you cannot get the care that you need or that your loved ones need. I interviewed the widow of a cancer patient whose doctor ordered an MRI for some hip pain that she was having and could not get the insurance to approve the MRI until she had 6 weeks of physical therapy. And during those 6 weeks, her pain got worse and worse and worse. And when she finally went for the MRI, she had a very aggressive type of bone cancer. And the bone cancer, the doctors who treated her said, if we could have started this treatment even 6 weeks earlier, even 3 weeks earlier, we might have been able to save her. And she died. And her husband tried to sue the health insurance companies and was unable to get success with that. He failed in his lawsuit. And so he told me his story. And as a result of that story, there is an effort in North Carolina and at other places across the country, but this was a North Carolina patient, to try to streamline, to require insurance companies to streamline the prior authorization process. That if a medical professional is recommending a certain procedure or scan or care, then they are required to respond in a timely manner, and they can't place all of these obstacles in front of the patients, especially when it's a situation where the provider really believes it's a life or death situation. So,
what is the reason for building more and more hospitals other than making more and more money?
well, the closer you are to a hospital, the faster you can get care. And so there is a benefit for patients to having a hospital close by. And the research shows that rural areas that don't have a hospital and people that have a long way to go to get to a hospital, they don't live as long. Their healthcare outcomes are not as good. And so there's a lot of benefit in having a hospital close to home. Now, do we need emergency departments in every corner of Charlotte? Probably not. But I did a story on those freestanding emergency departments that you guys might have seen popping up in different parts of Charlotte. And I don't know if you noticed this, but most of them are in Charlotte's more affluent areas. You're not going to find, there are just not, we map them, there's just not a lot of freestanding emergency departments in other parts of Charlotte. And even though hospitals, I don't think emergency rooms are profit centers for hospitals. But what an emergency room is an entry point for patients to other types of care. So the patient that comes to a Novant Health emergency room is going to be referred to a Novant Health orthopedic practice for whatever, for the hip replacement or the knee replacement or the shoulder replacement that they need. They're going to be referred to the Novant Health dermatologist or the Novant Health cardiologists, and those are the higher revenue generating specialties for healthcare systems.
What do you hear about Medicare for all?
So there's actually a group of doctors in Charlotte, and actually there's a nationwide group that is pushing for it, but I have not seen a lot of traction either at the state level or at the national level toward a universal healthcare system. Not yet.
Anything else? Any other questions for Michelle? All right. Unless anybody's got any other questions, I think that's going to do it for today. Thank you very much. Thank you for coming.
Okay, that's a wrap. To our listeners, thank you for listening.
This episode of the Charlotte Ledger Podcast is produced by Lindsey Banks.
QueenCityPodcastNetwork.com.